Hi, I'm Dr. Justin Greenslade, an upper gastrointestinal surgeon based in Brisbane and Queensland. I'd like to talk to you briefly about gastroesophageal reflux disease and the surgical options that are available to treat this. Reflux is a very common problem affecting many of us to some degree. Most of us make do with simple lifestyle modifications, avoiding triggering foods, taking care not to eat too late at night, reducing alcohol and caffeine and so forth. Some folk need to rely on medications, such as proton pump inhibitors or H2 antagonists, in order to cut acid levels down. But there will be a subset of people for whom these measures just aren't enough and their symptoms remain very intrusive. And in those cases, surgery may be an option to consider. There may also be people in whom medication does control their symptoms, but they just don't wish to take medication indefinitely. There are some growing concerns, for example, about taking proton pump inhibitors in the longer term and the effects that might have. So if you're in that category, the surgical procedure that we would be talking about is the laparoscopic fundoplication. This operation basically involves taking the top floppy part of the stomach called the fundus and wrapping it to some degree around the bottom of the esophagus. This creates a one-way valve effect that still allows people to swallow normally, but it prevents stomach content and acid moving backwards up into the esophagus. We also see if there's a hiatus hernia present. A hiatus hernia is where the top of the stomach is sliding up through the gap in the diaphragm into the lower chest. That puts the valve that guards the bottom of the esophagus into the wrong position, and that can further contribute to a reflux effect. So, if we find a hiatus hernia at the time of surgery, that is automatically corrected as part of the procedure. In preparing or working up people for this surgery, we do need to do at least an upper endoscopy. This is to see if there is, in fact, a hiatus hernia present, to also assess the lining of the esophagus and see if acid exposure has affected that, and to make sure there are no other pathologies present that could confound the situation. In some people, it may be necessary to pursue other investigations, such as a 24-hour pH study, if it's not quite clear if reflux is exactly what is causing their symptoms. There is an overlap with a lot of other conditions infecting the throat or the lungs that can make it unclear whether acid reflux is truly the problem. If a patient is then proceeding to surgery, having established that reflux is truly their problem and their symptoms are causing significant impact to their quality of life, then we would perform a laparoscopic procedure. We can wrap the stomach to different degrees around the esophagus. We can do a 360-degree wrap, which is called a Nissen fundoplication, or a partial wrap, a posterior wrap, which is called a toupee fundoplication, or an anterior wrap. I tend to favour the partial fundoplications as I find they strike a good balance between not letting people suffer persisting problems with their swallowing, but still giving a good anti-reflux effect. The operation is safe. With careful surgical technique, the chance of damaging any of the structures that are involved in the surgical field is very low. The inpatient hospital stay is typically 1 to 2 nights, but you do have to maintain a mushy or pureed diet for about 3 weeks after the surgery before graduating back to solid foods. If patients are correctly selected for this procedure, they can experience a profound improvement in the quality of their life with the amelioration of their reflux symptoms. If you feel that this is an avenue you'd like to explore further, I'd be very happy to talk to you and see what your options are. Thank you.